Good morning, everybody. Welcome to today's live update. I'm joined this morning by Vice Chancellor for Student Life Frank Cuevas, Provost John Zomchick, and Student Health Center Director Dr. Spencer Gregg. Today, we will talk about community testing, give an update on vaccines, go over the case count data, and check in on how things are going in the classroom. First, I want to start by thanking students who have been participating in our community saliva testing program and congratulating Orange Hall, the winner of our dorm makeover contest. Dr. Cuevas, you visited Orange Hall this week to share the news. What did they win and what was their reaction to it?
Thank you, Chancellor. It was fun and exciting to be over in Orange Hall yesterday to meet with the staff and some of the students to congratulate them on their participation levels and also to be winners of the Hall Makeover Contest. There was a lot of excitement. I can tell you that they get to choose from a variety of different packages to really enhance the residence hall experience: Adirondack chairs, hammocks, enhanced furniture, and TV upgrades. So I think all in all, it's going to improve their enhance the residential experience. They're really excited to start choosing a list of items to really add to the residence halls and the patio or either indoors. So I just want to say thank you to the Orange Hall residents for their consistently high participation rates. Continue to do it, and we'll have other halls who can choose down the road.
And I want to thank you. That is very creative. And the next round of competition started this week. So we also have individual prize packages for students. So make sure you are submitting your samples when it's your day. Commuter students, you are also eligible to participate in community testing and win prizes. As a reminder, if you live on campus or in Greek housing, participation in saliva testing is part of the housing agreement you signed, so you're required to do it. Last week's overall participation rate was 64%, which is still too low. For us to confidently lift restrictions that are now in place, we need at least 75% participation. We've begun lifting visitation restrictions for residence halls that have met the participation goal and kept low prevalence rates. So far, those that have restored visitation benefits include Orange Hall, Dogwood Hall, Alpha Gamma Rho House, Beta Upsilon Chi House, Delta Zeta House, Phi Kappa Psi House, and Sigma Phi Epsilon House. Thank you to all those students who've been doing their part to keep our campus safe. Now, Dr. Cuevas, what can students who have not been participating in testing expect?
Well, as you shared, beginning next week, the residence hall staff will be reaching out to those students that have not participated in any of our community pool saliva testing program. We're going to be contacting those students, reminding them of the importance to be part of the pool saliva and their obligation, because any student who lives in any on-campus residence, whether it be a residence hall or Greek housing, they have a contract addendum that obligates them to participate in our community testing program. We're also going to engage our volunteer families. We're going to work with our volunteer families to remind their student that they need to participate in the community testing program so that we can help keep the campus healthy and safe. I want to point out that because of the testing program, for those students that have already done so, we've been able to identify asymptomatic students who has really helped keep our prevalence rates low. So that messaging will be going out to our students who have not participated, and we'll be partnering and engaging with our families to do so.
Thank you, Dr. Cuevas, and a big shout out to those dorms and Greek houses who are doing well and got some of the restrictions lifted. Let's move everybody else into that category for the next week. That would be great. So now I want to switch gears and I want to check in with Dr. Gregg, who has been leading our efforts to distribute the vaccines. So Dr. Gregg, where do we stand this week with regards to vaccines?
Chancellor, happy Big Orange Friday.
Yeah,
it's good to be back with you again today. So since the beginning of February, we have provided right at 2,000 vaccines on campus, both to university-affiliated faculty, staff, and students, as well as to the Knoxville community. At the start of this semester, we'd seen a gradual increase in our active cases on campus, but since the end of January, we've seen that generally leveling off, which is great. We'd really hope that we wouldn't see a steep increase in cases like we did back at the beginning of the fall semester. So far we haven't. We'd like to continue seeing that flatness to the curve, or better yet, a decline through the remainder of the spring. So as we begin to see an increase in the number of folks, both on and off campus, who've received the vaccine, then we're hopeful it'll help us meet that goal.
Okay, great. So let's talk for a minute about the broader community. What is our campus's role when it comes to the broader community and the state effort to vaccinate Tennesseans?
Well, the state's goal is to have more and more of the vaccine readily available to those in the community who are phase eligible or age appropriate. And they'll do this by increasing the number of sites across the community where the vaccine may be accessed to coincide with the increased vaccine availability. Access sites will start to include local pharmacies and healthcare offices, as well as local health departments. Every site that has the vaccine will be publicly noted so that the community will know where the vaccine is located and how they can go about accessing it.
So a little bit more specifically then, what are our plans to make sure we're fulfilling that role? What are we doing?
Well, of course, our campus has volunteered to be a vaccine access site for the Knoxville community. We'll continue to hold public-facing community vaccines events for those who are phase eligible or age appropriate, like we had earlier this month. And we'll have vaccination opportunities for UT-affiliated faculty, staff, and students that are phase eligible or age appropriate through the Student Health Center as well. We're still in the planning stages for those upcoming on-campus vaccine clinics, and we'll publicly post information and links for signups as soon as that planning is finalized. Actually, we had hoped to start these on-campus vaccine clinics as early as next week, but the recent inclement weather across the U.S. has significantly impacted vaccine supply. So that's likely to be delayed by probably at least another week.
Okay. Dr. Gregg, this is great information, and thank you for that update and for all that you do. So now let's dig into the data and see where we are as of today. So as of this morning, we have 87 active positive cases. 68 of those positive cases are students and 19 are employees. There were 7 new cases reported yesterday. We now have 374 people in quarantine or self-isolation. This includes 220 students who live on campus, 91 students who live off campus, and 63 employees. I love the looks of that graph in that we don't see that big spike so far this semester. Let's talk about clusters. We have identified 3 new clusters this week. All of them are in Greek housing. In these cases, they've been identified as clusters simply because the living arrangements in sorority and fraternity houses, which lead to a lot of close contacts. So the first cluster is at the Kappa Kappa Gamma house. It was identified on Sunday with 4 positive cases and 24 close contacts, which is everyone else in the house. The next 2 were identified on Thursday, and student participation in our community saliva testing program helped us catch these early and work to prevent further spread. So one of the clusters identified is located in the Delta Gamma house, and it involves 3 positive cases of the virus and 25 close contacts. The other is at the AD Pi house. It involves 1 positive case and 25 close contacts. I want to thank the residents of all these houses, especially those last 2, for their commitment to participating in the community testing program. This is another example of why participation is so important to keeping everyone on campus safe. Everyone in all 3 houses has been very cooperative with contact tracing and with quarantining. They are doing exactly what they're supposed to do, and we appreciate their help. They get listed as a cluster again because of their tight and close living setting situation. So now I want to talk about testing. This is another thing that's on the website. Last week, we collected 4,047 samples. 3,929 of them were from residential students. We tested them in pools of about 3 to 5 samples each. That's why we call it pooled saliva testing. Out of the 905 pools, we identified 20 of them and 106 individuals who were referred for diagnostic testing. Of those who were tested, we identified 12 positive individuals, all of them residential students. As we said earlier, the overall participation rate for residential students was 64%, and we need that to increase. Our positivity rate across all 4,047 samples was 0.3. This is always a little bit hard to remember. That's 0.3 of 1%. That's where we are today. Dr. Gregg, what is your reaction to the case counts and the testing data? And how does it compare to what you're seeing over in the Student Health Center?
Chancellor, we're really pleased with what we're seeing on campus, especially when comparing it to the greater Knoxville community. As noted earlier, we're not seeing a big spike in cases like we did in the fall, and our active case counts are remaining flat. But as always, we'd still love to see those numbers declining. Our campus positivity rate remains significantly lower than the community, and this speaks volumes about the mitigation efforts we have in place on campus, as well as the willingness of our faculty, staff, and students to remain actively involved in those mitigation efforts. We've recently noted an increase in the number of self-isolations on campus, but that too may actually be good. This increase has been related in a large part to our early identification of asymptomatic positive cases through our pooled saliva testing, and then the subsequent identification of clusters related to those. With the isolation of those who are positive and the quarantining of their close contacts, it ultimately helps to drive our overall active case counts down. I would like to note, though, in regard to our community testing efforts, pooled saliva testing, we still need to see greater participation, both with our on-campus residents and commuters. We've increased the frequency of testing, but we've also increased the opportunities to participate, and we'd like to see more students taking advantage of that. Our ongoing testing is key to us keeping our active case numbers down and reducing our restrictions on campus.
Thank you very much for that update. So now let's look at our metrics summary. And as a reminder, this table includes indicators that we watch them, and we use them to assess where we are and to evaluate whether to lighten or ease some of the temporary restrictions. So first, here on campus, our daily average for new cases over the last 7 days has been 10.1. Roughly holding steady over the last week's average. We also monitor the cases in Knox County, which are at 25 per 100,000. That is down from last week. Both the hospital ICU capacity and adult bed capacity are at 12.5%. Both of those up from last week, which is good. As a reminder, this is a number we want to see increase. Our capacity to respond to positive cases and care for quarantining and isolating students remains high. Our contact tracers are still responding to all cases within 24 hours, and our diagnostic testing at the Student Health Center has a 1.5-day turnaround. Our 14-day positivity rate for community saliva testing is 0.38%. That's 0.38 of 1%. We are using about 16% of our quarantine beds, about 7% of our isolation beds. So we have plenty of capacity. Dr. Gregg, how are things trending in our broader community here in Knoxville? And what do you expect to see over the next few weeks and months?
Chancellor, it's great to see both our campus and community numbers improving. but we do have some concerns moving into late February and early March. It's predicted that within the U.S., we'll steadily see an increase in the number of cases related to new variants of the virus that are secondary to mutations that can increase the virus's ability to be more readily transmitted. With that potential, strict adherence to mitigation efforts remains key, especially in regard to the ongoing need for social distancing, mask wearing, hand hygiene, and avoidance of social gatherings where these measures aren't being followed or where eating and drinking are occurring. There's also some concerns that not only are these mutations allowing for greater transmission of the virus, but also potentially increasing the severity of illness, and that current vaccines may not fully cover these mutated variants. We'll have to continue to closely follow those concerns. The bottom line is that despite our present positive outlook on campus and in the community, we can't say for certain what the immediate future holds. We do know that social distancing, mask wearing, hand hygiene, and avoidance of social gatherings are all effective in reducing case counts. So with these new concerns, we must make sure that we remain vigilant and follow through on adhering to that guidance.
Thank you so much. So in summary, it's important that we do not let our guard down. We are so close to seeing some relief from this virus because of the vaccines as that are becoming more available. Please, all of us, we must remain vigilant. Before we go, I do want to talk a little bit about how things are going on in the classroom. So Provost Zomchick, it's hard to believe we're just a couple of weeks away from midterms. What are you hearing from faculty and students, and how are things going? Any adjustments they've made this semester? So what's going on in that area?
Thank you, Chancellor. I'll be happy to update everyone, and a happy Big Orange Friday to you and all our viewers. So it is hard to believe that we're through January and almost through February, approaching midterms. And on the front of instruction, I almost want to say that no news is good news. What I'm seeing across campus is faculty and students rolling up their sleeves and getting right to work. You know, there's a sense in which all of us have realized that special efforts, just as there are special health efforts that are required, special efforts in the instructional realm are important as well. And we're seeing faculty and students both doing that. But I want to add, as always, if students do have questions about their academic plans or need academic support, they should contact their advisor or our Academic Success Center. I do want to add one thing, though. As you know, and our audience might recall, that this spring we started something called Big Orange Welcome. It was really a new and greatly expanded orientation for our students, not only our students who started in January, but our students who started with us back in August. We expanded it from 1 week to 6 weeks. And I really need to give a shout out to Vice Provost Amber Williams and her team for all the programming that they provided for our students. We've had tremendous participation with almost 400 events. Students have been hiking, they've gone on ski trips, they've been playing hockey, taking sunset walks, vol socials, academic workshops, service events through the Jones Center for Leadership and Service, which our colleagues in Student Life run. We've had great collaboration with our colleagues in Student Life. So we've had fewer complaints from our students about having nothing to do. And I think that's boosted morale, and it's made their success in the classroom a little bit easier. Finally, next week marks the 6th and final week of Big Orange Welcome. And we're capping it off with Vol Success Week. I want to sort of give a highlight of 2 events that I really urge students to attend. One is Navigating Civil Discourse with Governors Bredesen and Haslam on Tuesday night at 6 o'clock. And Chancellor, you know you'll be there, and you'll be introducing the governors.
Yes.
And then on Thursday evening at 7:30, we're hosting a night with Netflix's Wade Davis, a vice president at Netflix, who's going to speak on transformative leadership to build inclusive excellence in workplaces in our communities. I'm excited about both those events. Those are just 2 of them. There are lots more for our students to take advantage of, and I urge them to do so. And remember, students, we're here for you. Your success is our success.
Wow, John, I wish you could just be a little more enthusiastic. That was awesome. I saw pictures this morning of some of our students skiing, and I thought, oh, wow, I'd like to be doing that also. So you know what? That's all we have for today. Thanks, everyone, my guests, for joining us, John, Frank, Dr. Gregg. Thank you also to students, parents, and others out there in the atmosphere who have joined us today. I hope you all have a really safe weekend. Stay healthy and go Vols.